I have Brad Nitschke, Associate General Counsel, Parkland Health, testifying for House Bill 44. Is that correct?
That's right.
Thank you. You may proceed.
Thank you, Chairman Van Dever, Vice Chair Campos, and members of the committee. My name is Brad Nitschke, and I'm an Associate General Counsel of Parkland Health, and I'm testifying in support of HB44. I appreciate Chair Guerin for authoring this important legislation and for the many individuals who helped craft it together. Parkland is Dallas County's public safety net hospital. We deliver more babies every year than any hospital in Texas by a long shot, and more than any other hospital in the country save one. At the same time, we're a level 4 maternal care designated facility that serves as a regional resource for mothers and families facing the most complex and complicated pregnancies and deliveries. You will not find a group of doctors and nurses who are more committed to the health and well-being of mothers and babies in Texas than the folks who work at Parkland. It is an unfortunate reality of that work, however, that some pregnancies don't progress as intended and as everyone hoped, while others arrive as a surprise to a mother whose health is already so weakened by disease that she and her baby cannot both safely endure pregnancy to term. In those terrible situations, probably the most difficult that the patient, her doctor, and nurse will face, where the law chooses to speak, it can and must do so with crystal clarity. Legal ambiguity in these cases places patients and doctors at risk, particularly where, as here, the law imposes a criminal consequence for those who are later judged to have acted in error. HB44 makes important strides towards that clarity in 3 key areas. First, by removing the duplicative use of the term life-threatening from Section 178.002, HB44 makes clear that a mother whose pregnancy-related emergency poses a serious risk of substantial impairment of a significant bodily function, but perhaps not yet death, may decide with her physician to end her pregnancy to avoid a life-altering disability. Second, HB44 clarifies that a physician is not required to delay termination of a pregnancy until an emergency reaches a certain clinical marker that indicates death or crippling disability is imminent. While this is something that the doctors at my hospital, a large teaching hospital with a full legal staff and a faculty full of complex pregnancy experts, already know, our experience in Texas over the last 4 years makes it clear that physicians who are fighting the good fight, solo staffing emergency departments in rural areas with no lawyer or MFM faculty on call at 2 a.m. on a Sunday, need this clarity to safely care for their patients and their own livelihoods. Third, HB44 helps to align a statutory definition with the corresponding medical definition by expanding the law's use of ectopic pregnancy, the removal of which is not, by definition, an abortion, to include additional pregnancies whose location alone, for example, implanted in the surgical scar left by a prior C-section, makes them a grave threat to the life of the mother. Again, the law has chosen to speak in these awful and complex situations, and to do so under penalty of criminal punishment. It is critical to the health and safety of Texas mothers, doctors, and nurses that it do so in the clearest possible terms. HB44 makes important progress in that direction, and I urge its passage.
Thank you.